All right, welcome back to another podcast. This week we have on the show, please welcome Mila Casey.
Thank you, Michael. Nice to be here. Thank you. Uh, really excited to be here.
Absolutely. So you were born in Russia,
Yeah.
correct? And you're an
Yes.
ophthalmologist.
Ophthalmologist. Yes.
Ophthalmologist, correct. And then you moved to Maryland, the States,
To the States. Correct. Yes.
correct.
Yes. Yes.
So explain your kind of journey because you had a journey of where
Mhm.
you were wearing corrective lenses as well
Mhm.
early on in your life. And was this after you were already an ophthalmologist,
That was after. Yes.
or was it
Yes.
after?
So
Okay,
that was the old kind of old age, as they say, vision. We all after 40, 50, when we turn at this age, our we can't see a small print, and we need to push it out, so we need to squint. So that's what happened to me as well at the same time. And I started wearing glasses. So just to answer your question, how it all happened. So I was born in Russia. I went to medical school, residency in ophthalmology. I did practice in Russia as an eye surgeon, and also I was treating diseases by surgery and medications, like all eye doctors. And then I met my husband, who is American, happened to be American. So I immigrated to the U.S. After been practicing for some time, and in the U.S. I did not go through the relicensing. We had two small children, and I just needed like a part-time job. So I found a job at the optical shop, and in the optical shop, that was very familiar. I had to just learn some things. It was easy job, part-time. So over time, as I was like explaining to people that they need glasses and like filling prescription, what they were getting from optometrist, um, I my vision actually declined at the same age, between age of 40 and 50. And my colleague was saying, "Oh, Mila, you'll need glasses soon, and why don't we make you glasses, since you need reading glasses, and so you can explain to people how to wear, how to get used to progressive lenses, which are very popular, like multifocal lenses." So I did, because it was, of course, obvious, natural. And so it's a long story, but over time, within 2 or 3 years after I immigrated to the US, I started having health issues with my GI and like intolerances. So gastroenterologists could not help me. They did all the tests, and they just said, this is IBS, irritable bowel syndrome, like many people are diagnosed. So I started researching myself. I stumbled upon like nutrition certification, and I got my certification. I was really interested. I guess, got rid of my sensitivities, got rid of gluten, dairy by that then. And yeah, I left partially optical shop, and I went to health coaching, and I worked for 3 years. I worked in wellness clinic as a nutrition consultant, which I loved. Um, so, and then we had to move to Turkey, because due to my husband's job. So we leave every 3 to 5 years. We have to move to another country. So I decided I need to go online, do my coaching online, and that's what I did. And I did turn like plant based about around 2018 also,
And that
learning.
helps, obviously.
Yes, yes,
So at some point, you become exposed to the Bates method, correct?
correct. And that
So,
was recently,
oh, that's
relatively.
recently. Okay, explain to everyone what that is and how that helped formulate some of your opinions
Mhm.
on this type of care.
Yeah. So exactly 3 years ago, I just listened to some plant-based podcast, in this community, and one of the vision educators um, were interviewed, and I learned about Bates method, which I had no idea existed. So Dr. Bates was an ophthalmologist who practiced over 100 years ago in New York City. He was a surgeon and regular eye doctor. So Dr. Bates discovered by just occasionally he saw that his patients spontaneously improved their vision, and they were the patients who refused to wear glasses. So he started researching more, and by during his research, he discovered that poor vision is caused by mental strain, poor vision habits, and wearing glasses. So he started, along with his medical practice, he actually started helping people to get rid of glasses, improve, nearsightedness, farsightedness, astigmatism, amblyopia, strabismus or crossed eyes, and even like cataract, glaucoma improved with his method that he created. So over time, the followers of he discovered this method, he started helping, and then more and more people got interested and they became teachers or like vision educators of Bates method, um, which after his death, I guess they started use, using this name Bates method for this method, natural vision improvement method. So um, that's how it works. And now there are like all over the world, there are vision educators who are helping people, and they're not necessarily eye doctors. They are just regular people who improve their vision and want to help other people. There are very few like optometrists, some ophthalmologists, which I met at the recent conference in Spain. Very few still doctors who actually practice this method. But I'm hoping this community grows and more doctors will join. So when I learned about this method, I was very skeptical. And but learning about Dr. Bates, he was an ophthalmologist just like me. I decided to test this method, and I found the vision teacher online who wrote multiple books, very experienced teacher, and she helped me to improve vision. I read her books, and we had several sessions, and within three to 4 months, I stopped using my glasses. But my vision was not as bad as other people's. It's so
Okay.
everybody's different.
Right. The more extreme cases obviously would take more because this is
Yeah,
a therapy, is it not? Basically, the type of
right. This
therapy,
is education, so we don't
education.
call it therapy because we're not, we're vision
Therapist.
educators, right?
Sure.
It's yeah,
But there's a specific protocol that the vision educator is having you follow in order to get the eyesight back, right?
correct,
Right.
correct. These are
So,
vision practices.
excuse me?
Yeah, we call it vision practices, certain vision practices. Mhm.
Practices. Okay. So they're first of all, and we talk about the lot about this on the show, and this goes to health. and you've been over 15 years health and wellness, correct?
Hmm.
So we always talk about how first you have to stop doing the offending behaviors is what I like to
Right.
call them, because like that's the first, people always want to go to, people are always asking, I'm sure they do this too, is like, well, what can I eat for this and this, and I'm always like, well, what, let's first talk about what you have to stop eating.
Hmm.
Then we can go on to the other things. So what are some of the things that we first have to stop doing, to our eyes or with our eyes, which is furthering the problems?
Well, our eyes are part of our body. In fact, they are actually part of our brain, right? So, what's good for our body, for our heart, is also good for our eyes because the general circulation, the improving, cardiovascular health will affect any single organ in our body, including brain and eyes, right? So there is no specific, with some exceptions, like foods that you need to eat for the good health. It's whole food, plant-based eating, right? It's
Right.
the best for the whole body, including vision, especially for vision.
Yeah, I mean, we all know that blood vessels are carrying blood to every organ, every muscle, every ligament, everything. So, and we talk a lot about Alzheimer's and these type of brain diseases, cognitive diseases, and it's basically the same thing. It's clogged arteries to the system, right? So it makes sense that
Yeah,
clogged arteries to the eyes are
yeah,
gonna cause issues with the eyes.
absolutely. Yeah, yeah. And
So you improve the diet, obviously. And so if a person's out there, okay, well, I'm doing the things, I'm getting a lot of cardiovascular exercise in to improve my blood flow, improve my heart, get the
mhm.
blood flowing going. I'm cut out all the fat. So I'm not clogging up the system with fat. And so I'm doing all the right things. Are there things that they still might be doing that are still hindering their progress of getting their eyesight better?
Yes. So as I said, like there are three reasons for poor eyesight that Dr. Bates discovered. There are mental strain, right? So our vision is 90% mental. It's it's the stress. If you notice, for example, you in a state of stress, your vision is blurry, right?
Yeah.
You are it's Everybody probably experienced that. So by relaxation, mental relaxation, local relaxation, any meditation, this is like holistic approach to the eyesight as well. So and Dr. Bates discovered that the muscles that hold the eyeball, and it's actually, I have this little eyeball here, but there are like four muscles that hold and move the eyeball. Uh, I'm sorry, six muscles that hold the eyeball. So I'm putting my sixth finger here.
Yeah.
So they change the shape of the eyeball, and they can actually get tense and strain. That creates a strain as well. So by releasing the whole body and the eye muscles, we can change the shape of the eyeball. We can change the focal point, right?
Okay.
Because when a person has nearsight, when person can see far, he's nearsighted, right? The
Right.
eyeball actually elongated, just like this. And when person is farsighted, the eyeball is shortened, and that's like muscles. Certain muscles can do that. So by releasing these muscles with a certain relaxation practices and vision practices, we can improve the eyesight. So refractive errors, as we call it.
So you're right. So you're getting the eyeball and the muscles surrounding it. Not only are you getting it blood flow with the proper diet and good
Yeah.
heart uh, protocols, but you're also releasing tension because that seems to be the main theme that you're talking about is that we have this constant tension around the muscular structure of the eyeball.
Yes.
So then, obviously, we're always told that staring at screens, as I'm staring at a screen right now, is not good for the eyes. Is that true?
Right. Staring is not good for the eyes, period. Right. So when we're looking at this, when we work with a computer screen, we tend to blink less. And actually, less blinking creates the dry eye syndrome, which is like every other person probably has, and recommended lubricating drops. You can correct that because with the dry, just start try staring, not staring like for even 30 seconds. You'll see that your vision is blurred. So I would suggest for people, pay attention to not staring and blinking more. And that's one of the suggestions and habits, this vision habits that Bates was teaching. Um, and yes, staring is one of the issues.
Sure. Yeah, and we're staring at screens all day long on the phone, on the computer, especially if you work a desk job. My wife works a desk job. She's in finance, so she stares at a screen the entire day. And she had dry eyes a lot. But what she noticed was, and maybe you can speak to this because this is interesting, but she would put eye drops in her eyes to hydrate her eyes. But
Hmm.
she realized the eye drops were actually making her eyes drier. So
Hmm.
she stopped the eye drops and the dryness actually went away.
Okay,
Is
yeah.
that common?
It's common because it's also, individual sensitivity to some preservatives in this lubricating drops.
Sure.
Yes, they help temporarily, but
Right.
you're not addressing the root cause.
Yeah.
So and you can just try, rapid blinking for 30 seconds. You can try rapid blinking, and this will like massage your eyelids, which release this lipid layer of the tears that dries. So it's really like a micro massage of the eyelids will release more tears.
Sure. Well, it's interesting because it's just getting back to the old adage that the body knows how to heal itself. You just have to allow it to do that. And there's exercises that we do at the gym or that we do in our house to stay mobile and stay flexible. And the eye is no different because it's just yet another muscular structure, right?
Correct. Yeah. And so, like talking about like sitting in front of the computer all day, and like many of us do, like work online, right? So, you need to also think about ergonomics of your like posture, because that also will affect the eyesight, the tension, right? The tension in your shoulders, neck, your head. It all affects it goes to the eyes as well. So I would say, for everybody, your computer, the top of your screen should be on your eye level, and
Yeah.
that would not create any tension. So, like putting your dashboard, at the same level, and not having your hands. It's all, tension in your hands also will affect that. It's the
Yeah,
whole body.
seems like all tension in that whole area is going to affect the eyes because everything in the body's connected, and that's what we talked about with Eileen
Right.
Kaufsaftis, is that the whole body is one whole organism. So tension in one area of the body is going to cause tension in another area of the body.
Yeah, everything's connected to everything. Yes,
Yeah.
absolutely. Yeah, yeah.
When you talked about cardiovascular health and how that increases blood flow and helps with the eyesight, it reminded me of because I started wearing glasses about 7 years ago.
Mhm.
And I notice now that if I go to the gym and I'm going to shower at the gym, I will take my glasses off and go take the shower and come back, and then I have to read my padlock. And
Hmm.
some days, and I don't have my glasses on. Some days I can squint and I can see it
Right.
pretty well, actually, without the
Yeah.
glasses. And some days without the glasses, I can barely read the numbers and the letters on the padlock. So obviously, something I'm doing that day or the day before was better than I did previous days, right? Because more sleep, more water, more hydration, more all these things, right?
That's also, yes. But, Dr. Bates used to call eyeglasses crutches, crutches for your eyes. If
Sure.
you think about it, right? It's our vision changes throughout the day, changes every day, depends, right? But when we go to the doctor and the eye doctor checks your vision and he prescribes you the eyeglasses, he prescribes you the eyeglasses. Your prescription is correct for that particular moment,
Right.
right? So it changes all the time. So Dr. Bates was actually saying, okay, go to cold turkey, and take off your glasses. Do not use them. We can't afford it in nowadays. We need to see, we need to work with the documents. So our first suggestion usually, start using your glasses only as when absolutely necessary, when it's like when it's safe environment at home, spend some time of your day without your glasses. You can see something, and by doing this, your vision actually will improve with the time, and you will gradually maybe um, will reduce your prescription. So, for example, if you use like over the counter readers plus two now, you can gradually start using plus 1.5, right?
Sure.
Or plus 1.75 and one for 1.5 and one. That's the approach. That's like a milder approach, but that will that alone will improve your vision. There is also good transition method using pinhole glasses. You can get pinhole glasses and you can use them, you know, reading at your computer. Of course, not driving, it's not safe, but just in your around the house, you can use them and you will be surprised how well they work.
Interesting.
Yeah.
So, is it safe to say that if someone is going to get corrective lenses, then they're pretty much guaranteed they will always need corrective lens if they don't do these other things, obviously.
Right.
But if so, because you're saying it's a crutch, I mean, the leg is never going to get better if you're always on the crutches. You have to do things to rehab the leg and get the leg better so that it
Right.
can work without the crutches. So, is it safe to say that once you start wearing glasses, you're pretty much going to be always wearing glasses?
Yeah. It'll be worth it. Yeah.
It, because with mine, and
It'll be
it's the
getting
prescription gets different every year. And
correct.
everyone hates going uh, to the eye doctor because, you do the exam and, what's, number 2 or number 1, number 1 or number 2, which one looks clearer? And a lot of times when you're in the office, it's hard to determine that, right? It's like
Yeah.
sometimes I'm like, I don't know, they both look pretty much the same
Yeah.
to me. I can't tell which one is any different, to be honest with you. you know?
Correct. Yes. Well, it's a stressful. It's a choice you have to make, right? By itself, it's stressful,
Yeah,
and there is a white coat effect, of course, for many people,
sure.
right? I'm. We're not saying that don't go to the eye doctor. It's every everybody has to check their
Yeah,
eye health, right? Once every year or two. That's good, but in terms of prescribing glasses, prescription glasses, it could be helped with the natural method.
sure. Well, what's interesting is I've been wearing glasses, I think about 50, so probably 7 years now.
Hmm.
And every year the prescription needed to be adjusted, like you
Yeah.
talked about, right? Because it's only in that moment. So then by the time you come to a year later, of course, there needs to be adjustments. This last year, in January of this, not now, a year ago, January, I went in and I did not need any adjustments. And I asked the doctor, I said, he's like, what did you do differently? Everything looks great.
Hmm.
And I said, I started eating a lot of carrots. And
Hmm.
everyone laughs about this. But I asked him, I said, is there any real truth to that? And he said, absolutely. Do you agree with that?
Yeah, I do agree. Partly it's true. And so there are very important antioxidants like carotenoids that we get with the carrots, with the bright orange vegetables and fruit. But there are more important antioxidants. They called retinal pigments, retinal antioxidants that called lutein and zeaxanthin, and they're actually very important. They're essential for our central vision. For um, they they actually there is a certain concentration of them in the retina, and we get it from the food. So the one of the champions in the the contents of these antioxidants, kale kale is the top.
Oh, okay.
Yeah. So green leafy vegetables, yes. Make your smoothie in the morning with some fruit, and of course, yes, yeah, bright orange fruit and vegetables.
Sure.
Carrots
Go
don't.
ahead. Go ahead.
Carrots do have some, but not as high as kale.
Oh, okay. So, what would be a couple other ones that would be obviously yellow peppers, orange peppers, sweet
Mango,
potatoes,
correct.
mangoes?
Hmm.
Gotcha.
Tomatoes, yeah, yeah.
Yeah, because you take a guy like me who's vegan 8 years now
Hmm.
and whole food vegan. I always try to clarify that because I'm not doing Coca
Yes,
Cola and Oreos
correct. Yeah.
and fake burgers and whatnot. So for me, my diet is pretty hardcore. So it's all the things you just mentioned. Although I'm an arugula guy because I love the taste of it, but I do like kale as well. So I'm going to make that switch. So you have a person who's doing all the right things, eating all the right foods, still has their glasses. They could
Hmm.
benefit from working with a vision specialist to help them do some type of protocols, right? To help move that, to work in conjunction with the diet.
Yeah, yeah, that's definitely helps.
Yeah.
And that's, yeah, Bates method, implementing these vision practices into your everyday life. It's not just like method of treatment. It's the way. So Dr. Bates was used to say, and you can read in his magazines and books, used to say, it's the method of like using your eyes naturally, because people with the 100% vision, right, with the 20/20, they don't think how they use how they use their eyes, right?
Right.
They just see well naturally, and how, like, without strain, without squint, without any tension. So yes, there's certain practices, so we don't call it exercises. Some people call it exercises. It's, yeah, vision practices.
Yeah, it's kind of things you do daily, like you do other things daily, right? You brush your teeth
Mhm.
every day, keep
Right.
your teeth health well. Like these are all the things that you kind of do on a daily basis just for general health. Like you said, no one really thinks about this. It's just what you do.
Yes.
I think
Yes.
the only people that really think about their eyes is people who are wearing glasses,
Right. Yes.
right?
Yes.
Because before I wore glasses, I never gave one thought about eye health or
Right.
what I should do on a
Or-
daily basis,
mhm.
how much I look at this computer screen. You had
Right.
something interesting in one of your presentations. I thought we could just touch on this real quick. Is the eye exams? Um, there's a difference between an ophthalmologist and an optometrist, right? And an
Mhm.
optician. Can you just
Yeah.
briefly kind of explain the difference of that? Because people are still going to need to go, like you said, yearly and at least get their eyes look for glaucoma and cataracts and these other things, right?
Yes. Yes. So the eye doctor ophthalmologist. So I was trained, I went to medical school. It's a medical doctor ophthalmologist. So ophthalmologists treat diseases, they prescribe medications, they do surgeries, and they also prescribe glasses to people. So optometrists, like doctor of optometry, DO, they they only treat conservatively. It's they don't do surgeries. They do everything else, just like ophthalmologists, but no surgeries.
Okay.
And some of them are really good diagnostics. So it's okay to go to optometrists to to check your vision, because they do check for glaucoma, they do check for cataracts, they check your vision, and as needed, they can direct you to ophthalmologist if you have issue. Opticians work in optical shops. They're people who deal with your prescriptions. So you go from optometrist or ophthalmologist to optical shop, an optician greets you, you give him your prescription, an optician makes your glasses. And they do measurements, they deal with the lenses, cutting the lenses, and fitting you with the frames and etc.
Sure. So it's safe to say that the ophthalmologist is where you're going to go if you need a procedure or you need correction to be done, whether surgery or some type of procedure. But the optometrist is for evaluating, if
Right.
that's a good way to say it.
Yes. Yes.
And you do agree that people should go, no matter what your eyesight is, wearing glasses or not wearing glasses, you should have a checkup every 1 or 2 years to see what your eye health looks like.
Yeah, definitely. Yeah. Baseline.
Yeah, baseline.
Mm-hmm.
Excellent. And then the one last thing I wanted you to touch on real quick is floaters, because I hear
Mm-hmm.
people talk about that a lot, where you'll have just a little speck in your eye that you kind of see as you move your eye
Mm-hmm.
around, which we call floaters. What are those exactly, and is there a way to improve that?
Mm-hmm. So floaters are they're proteins. So with our eyeball is filled with jelly-like substance called vitreous humor. So with the age, and it actually the structure of it is water and collagen. So with the age, this vitreous humor liquefies, and collagen they break down. So that's what we see, which is natural. Of course, I believe that it depends. If you have good nutrition, you have less floaters, definitely, because
Yeah,
it happened to me when I turned like plant-based. Absolutely. um, Also the strain, certain stress and strain creates that. But what dealing I can tell people, so if you notice just floaters, these are clear specks that float in your eyes, this is safe. But sometimes, since vitreous humor becomes liquefied, it can pull actually and create vitreous detachment, and we call it PVD, or posterior vitreous detachment. That's when symptoms become more prominent, and they see the maybe like a curtain floating. And so in this case, it's definitely good to check, go to the doctor. um, Vitreous detachment usually harmless, and it needs to be observed. Usually, will doctor tell you it needs to be observed, because the complication of that could be retinal detachment as well. So it's
sure.
definitely essential to check with the eye doctor. And
Excellent.
I'll tell you what Dr. Bates used to recommend for when people have floaters.
Sure.
Just well, first of all, there are like several things you can do. First, just ignore the floaters. Second, you can just chase them. By chasing them, structurally, you can actually break those collagen fibers by, moving your eye and you chasing them, you're moving the vitreous humor, and that makes sense. Like when I can explain that. So, and just, yeah, ignoring them. Do not ignore more, scary symptoms like a curtain in front of the eye. But that's one of the,
Yeah.
methods to deal with them.
Excellent. Well, great discussion. Really, really was obviously myself wearing glasses. I was very interested in having this discussion and learning more things. You obviously, so are you you're able to help people with their vision as well? I know you do the health coaching as well, but you also do the vision coaching.
Yes,
Oh,
I
excellent.
do. Yes, vision coaching, and I do have the quarterly courses, like a 5-week course that I teach, and I help people. So I teach the basics of Bates method, and of course, we're addressing individual, issues. Everybody's vision is different.
Sure. Excellent. Well, great discussion. I really appreciate you having me on the show. Why don't you let people know where they can find you on online and can hire you and consult with you and get help with their eye issues and or their health coaching issues as well.
Yeah, yeah. Thank you, Michael. My website called Mila's Wellness Vision, .com, and you can find all information there. I'm also on Instagram, and I have a Facebook group as well, like Eye Health and Wellness. Uh, so where I post like weekly, maybe a couple times a week. So whoever is using Facebook also can join.
Excellent, excellent. Well, I'll put all the links to all the places people can find you and they can reach out to you for some help. I'll put that all in the description box and we'll get the word out there for you guys.
Thank you. Thank you.
Awesome. Well, Mila Casey, I thank you so much for your time. I really appreciate it.
Thank you so much. I appreciate it too.